This is the most frequently used source for collection for cerebrospinal fluid. It is adaptable to subjects for all ages and relatively safe. Indications for lumbar puncture are suspected infection, malignancy, installation for intrathecal chemotherapy, measurement of opening pressure. Prepare the following materials: 1% lidocaine, betadine solution, sterile hand towels, 26 gauge hypodermic needle, 22 gauge hypodermic needle, 5 ml syringe, sterile test tubes with stoppers, sterile cotton balls, sterile 4x4 gauze sponges, freeway stopcock, sterile sponge forceps, manometer. It cannot be emphasized too strongly that proper position and adequate restraint are essential for a successful tap. The patient is placed on the side near the edge of the table. The head is supported by a pillow, the neck is flexed, and the knees are drawn upward to meet the downcoming head. The site for lumbar puncture is easily located. A line joining the highest points of the two iliac crests passes just above the fourth lumbar spine. The spinous processes of the third and fifth vertebrae are palpated in the midline, locating the L3 to L4 interspace and the L4 to L5 interspace. With the patient in proper position, gauze sponges held with forceps are dipped in tincture of iodine and applied first to the exact puncture site. The skin is prepared by swabbing in circles of increasing radii away from the operative site. The iodine is removed with 70% alcohol swabs using the same manner. A surface area of 10 cm in every direction around the puncture site should be sterilized. Sterile towels are draped above and below the operative area, leaving an adequately exposed working space. The selected interspace is carefully located by the operator wearing sterile rubber gloves and is marked by fingernail pressure. A wheal is produced with 1% lidocaine over the puncture site. Then, the underlying tissues are infiltrated down to the lamina. Always aspirate before each injection to assure that the needle is not in a vessel or the spinal canal. Wait 3 to 5 minutes for anesthetic effect. The needle is introduced exactly in the midline. It may be held either on one hand with about 1 cm of the needle barrel visible, or held with both hands with the thumbs on either side of the needle hub and the index fingers of both hands supporting the needle barrel between them. As the needle passes through the deeper tissues, a resistance change or pop feeling is encountered in the dura. The stylet is removed from the needle to see if spinal fluid is present. When the needle is in proper place and a free drip of spinal fluid is established, the final pressure manometer is attached to the needle hub by means of a three-way stopcock. Fluid is allowed to fill the manometer and the height of the column is measured in millimeters. The spinal fluid pressure is measured before and after fluid is removed. Collect the free flow CSF in 4 different test tubes. The first test tube is for culture and gram stain. The second test tube is for glucose and protein levels. The third test tube is for cell count and differential count.